home microneedling versus in-clinic microneedling, and in between the spa microneedling. What's the difference? Well, the main difference is this. One, we have radiofrequency energy. And the radiofrequency energy has a lot of different effects, which I'll explain in a while. The second is needle depth. We can go much deeper with our microneedling because we can use numbing cream. Now, if you're doing it at home and you don't have numbing cream, it's painful. So your needle depth is very shallow, maybe 0.1, 0.2 millimeter. When you go to 0.3, it's getting to be a bit more painful, and after that you get bleeding and it's ouch. So those are the two main things. And of course, you're talking about hygiene and some of the other things and some of the topicals where you put it. But the main advantage that we have is the radiofrequency microneedling, which is the energy. When you're just putting a needle in the skin, you're just creating some trauma, you're just creating some injury, and the skin heals after that. And maybe you put some stuff on it, it increases the absorption. That's all you're trying to do. But for us, when we use the energy, we are targeting specific problems in the skin that we want to treat. Pulse radiofrequency microneedling, the radiofrequency comes in pulses, so there's no heat or little heat, but it is designed for the overactive blood vessels, specifically for melasma. It also helps repair the basal membrane and decreases the inflammation. This is a very good treatment for pigmentation. Downtime about 1 day, and it's also a very good skin firming treatment. It grows collagen, it grows elastin, it makes the skin firmer and thicker. So it's for pigmentation. It's also for red acne scars, and also grows a little bit of collagen. So that pulse radiofrequency microneedling, the energy helps do all these things, which you don't get without energy. Now, continuous wave microneedling is a very strong, aggressive treatment for deep acne scars. The needles are strong enough to go in and break the fibrous walls, and we grow a lot of collagen and elastin. Biggest problem with continuous wave microneedling, it is uncomfortable. You really need to use a lot of numbing cream to make sure you don't feel any pain. There's a bit of downtime, could be up to 3 days, 5 days of redness and a bit of flaking on the skin. A low risk of complication of post-inflammatory hyperpigmentation, a little bit of brown marks on the face, which we can clear for the laser. Because you got no choice. You got deep acne scars, yes, we have no choice but to do this to make your skin smoother. Now the spas, they can't use the numbing cream, they can't use the energy. So what they do is they use a slightly deeper needle depth, and it's painful because you won't do it for yourself, because the second you go out, you stop. But somebody doing it for you, maybe they can distract you with something else. So that's the difference between our microneedling, radiofrequency together with the energy-based devices, and the topicals, and of course the numbing cream. What else can we do? We have many other machines in the clinic can bring down the inflammation so the downtime is less. We have lasers that we can complement with LED lights. We've got a lot of other stuff. So microneedling on its own is one part of a treatment. We could do 4 or 5 things at that session and just potentiate. So like we could do 2 or 3 things. So we could say, okay, you're going to have a lot of redness and inflammation. I will do this to make the inflammation a lot shorter. I will put this topical on because you can get better results. Maybe I'll just do a combination of this and that to get better results. So it really depends on what the patient wants.